why can't physical therapists crack my back? Because they're doing pretty much the same thing. It's not about the difference between chiro and physical therapy. It's more about the question of,
as a physical therapist, what can physical therapists do that chiropractors cannot? Can they really diagnose?
Well, it depends on the case. There's a few things. So first, even with that third-party consideration,
Or they are relying on the referral physician's diagnosis to treat the patient?
why would you choose chiropractic when you can choose something called functional medicine? But I feel like the backbone for physical therapists will be two things that are competing with each other. One of them is therapeutic exercise. The other one is joint mobilizations.
Do you agree that physical exercise, therapeutic exercise, is the physical therapy? But the backbone of what chiropractors are known for is the spine. Welcome back to our second episode of Bridging the Gap between holistic and allopathic care. But today we have a very good special guest that I'm bringing on, a physical therapist and Dr. David Tucker that we had the podcast on previous. We're going to be talking about what are the differences between chiropractic and physical therapy. Who should someone go to for any musculoskeletal conditions or issues? And I get these questions all the time. What are the misconceptions between physical therapy and chiropractic that people are hearing about? So we're going to be talking about this topic and discussing what are the differences. I'd like to introduce Dr. Gabriel Malakoff and Dr. David Tucker, who was with me last time. Welcome.
Welcome.
So I would like to start with Dr. Malakoff. If you can please tell us a little bit about yourself. Where are you practicing? What kind of physical therapy are you practicing?
Good afternoon to everyone. It's a pleasure and truly an honor to be here today. I am a physical therapist who has been practicing in New York for over 20 years, which I can't believe myself. But I definitely have been privileged enough to be able to interact with a lot of different practitioners as part of my delivery of physical therapy to my patients, and interacting with orthopedists, primary care physicians, chiropractors, and other specialists truly has been amazing. And so I pride myself in having a little bit of that kind of background, and happy to have a discussion on how we can work together with chiropractors to deliver an even better care, hopefully.
Thank you. Dr. Tucker, about your experience.
well, we're located in Langhorne, Pennsylvania. So it's a suburb just north of Philadelphia. And in my case, it's also been over 20 years where time has flown by. We have a family practice with a few docs that specialize in different tendencies from pediatric to geriatric care.
Awesome. So do you guys hear this question a lot? What's the difference between chiropractic and physical therapy? Dr. Malakoff, if you don't mind, tell us about it.
I personally hear a different type of question from many of the patients. It's not about the difference between chiro and physical therapy. It's more about the question of, why can't physical therapists crack my back? Because they're doing pretty much the same thing. So I just explained to them that we had not been trained in that, but we can always refer you to Dr. Nektalov, who is an expert in that.
Can you elaborate? What does that mean? So when somebody says that, can you crack my back, because pretty much are doing the same thing, what does that mean, same thing, in their
Okay.
mind?
So in their mind, that when we apply physical therapy modalities, whether it's hot back or electrical stimulation or doing massage, compared to, let's say, what chiropractors do in cracking and adjustment, they feel that they kind of get the same thing, but they have a much better feeling after coming out of a chiropractic adjustment rather than getting massage and hot back and stimulation.
Okay, we're definitely going to get back. Yes.
Plus, I feel like they also find a lot of value in like getting that in and out experience. They come in, they get cracked and out, rather than doing therapy for 45 minutes to an hour and getting stuck in the office.
I definitely want to talk about, is massage truly, I guess it's a modality you can use, but is it really the backbone of physical therapy? But we'll get back to that. Dr. Tucker, your opinion about this question.
Yeah, I would tend to agree with him in the fact that I don't hear it phrased as often your way as I do his. Like, what's the distinction between the two? Why, what order should they receive it? Can they do it at the same time? I think, they've got subjective complaints they want to fix ASAP, and they're just trying to figure out how to go about it.
Okay. So, what would you say the difference? What would you say the difference? Are you getting this question? What's the difference between physical therapy and chiropractic?
I wouldn't say that's a question I pose too much. I think most people think they're going to get some sort of spinal adjustment at a chiropractic office, even though they don't understand what that means, the benefits of it exactly, any of the implications. And I think they understand there's some work to be put in with PT as well in terms of, committing a little more to exercise.
Okay, all right. Do you also get like from interns? I know Dr. Malikov has interns that come into your office and they shadowing to decide whether they should go to a physical therapy school or not. So, do you get the question, should I go to PT or chiro school or
That question I actually did receive from my interns on some occasions. And I typically respond to them with the most generic type of answer. I say, everything is driven by what it is that your passion is. And it's hard to determine what your passion is unless you do it for a few years. But there is one thing that is definitely more advantageous being in a physical therapy world is that most insurances will cover it, as opposed to chiropractic care, which is not covered, let's say, by a Medicaid type of managed care plans, which makes it a little bit difficult to survive.
okay? What about you, Dr. Tucker?
So for me, it's more a matter of philosophy. I think insurance-wise, of the states I've been in, Medicaid does cover chiropractic. I think a lot of practitioners I know opt out of that one particular plan because they might not allow them to give the quality of care they want to give. If you're limited to a 30-second experience on day one because your E&M code isn't covered, they might not want to accept it. So I don't think coverage is always the issue. Referrals may vary, right? I think it's more common for a GP to refer to PT first. So it's kind of a little bit, I guess, less resistance for them for that initial referral. In terms of what they want to do and following their passion, obviously sometimes it takes time to discover it, but I think really it comes down to philosophy. So if they've been exposed to seeing patient outcomes, communicating with a few docs about what their day-to-day looks like, what the end goal is before they start, that's the secret, to find their purpose.
Okay, so go ahead.
I just wanted to make a little correction because we are in a heavy duty Medicaid HMO community, Jackson Heights, Queens. And as we tried to bring in other specialists, we actually made inquiries on whether managed care Medicaid plans like Fidelis Health First, Metro Plus, and WellCare cover chiropractic, and they say no, it does not cover chiropractic specifically. So I believe that that can be disadvantageous unless you have a different kind of
So what Dr. Tucker was trying to make a point about is philosophy. When we talk about philosophy, we tend to not to be too stuck to insurance, what insurance will cover or not, because it limits you what can you really give to the patient. Am I wrong?
Well, I think it's both. And I'm sure it might vary per region. Like I said, Medicaid covers chiropractic by me, but there's not necessarily any good chiropractors I'd refer someone to Medicaid with. Meaning they can go to like some sort of assembly line mill and have a different experience that's covered. But like for a friend or family member, I just don't know too many providers that I look up to that I think would give great quality of care would necessarily participate.
So do you believe that because someone who takes Medicaid, the quality of care is less?
I don't want to
Or is it by
generalize
default?
time. I think there's just limitations, right? It's like having a pre-cert with a certain TPA that says, hey, look, you can touch their cervical spine, not their thoracic, their left hip, but not their ankle. Like you're having someone else play doctor that's, it becomes bureaucratic. So I think there's reasons people opt out.
Okay, so anything you want to mention about that, Dr. Gabriel?
No, I feel like being in a Medicaid environment generally forces you sometimes to cut corners, and it's a valid and legitimate type of thought that sometimes in Medicaid clinics things do not go as well as they should be. Yes.
But to answer a question to an intern, to make him, to help him to make a decision, uh, whether go to chiropractic school or physical therapy school, scope of practice, advantages and disadvantages, Dr. Gabriel.
Okay, so I have been asked to deliver a speech to college students. I had not delivered it yet, and I thought about what is it that I'm going to say. And I came to the conclusion that I'm going to say that physical therapy is the best profession in the world. And the question is why? So the answer is I feel like because it is a dynamic profession where you're dealing with individuals and you're finding yourself walking in the gym and doing activities that involve a lot of ambulation and a lot of physical mobility. I think you keep yourself very healthy for many, many years. As far as what are the financial benefits, I feel like it all depends on who you are in a sense of being a go-getter or not. But as far as like biomechanically, I feel like it's literally the most well-balanced profession there is.
Okay, what about you, Dr. Tucker?
So I guess, again, I would start with a broader philosophical perspective. So, just to piggyback off the major medical component, if I was opening an elite gym, an elite yoga studio, a top nutritional facility, and so on, I wouldn't necessarily, my first thought wouldn't necessarily be, does insurance cover it? If I want to provide a great service, I want to provide a great service, and everything else is secondary. So for me, philosophically, I believe treating the root cause of someone's health problem is essential for the outcomes I want to see, the way I'd want to manage it for myself. With that, the appeal retrospectively, now that I've been in the field for so long, is that chiropractic is one of the few fields that looks at solutions that are very heavy on ruling out conservative care first. Not to say there's no co-management, but there is a heavy approach to trying to treat things without drugs, without surgery. Again, everything has its place, but if someone philosophically sees that, for me, there's no better field that aligns with my values.
I think the philosophy that person will get later on in their career. What I'm trying to get at, and you'll put in your inputs, little like basic stuff. Now, as a physical therapist, what can physical therapists do that chiropractors cannot? For example, that's my opinion. So, as a chiropractor, we're able to take X-rays, imaging, request MRI studies, blood work, urine test, utilize nutritional supplementations. And our scope is a little bit more open than just musculoskeletal issues. Whereas physical therapists, it's a pure musculoskeletal issues. Can they really, I'm not even sure, can they really diagnose, right? Or they are relying on the referral physician's diagnosis to treat the patient. What would you say about that?
So it's interesting you gentlemen brought up this concept of looking at the entirety of the patient, right? And just to answer a question on whether we're allowed to establish a diagnosis, the answer is no. Although going from PT to DPT allows us to have a little bit more of an independent look at what's happening. By current regulations, it's the MD or other practitioners that establish a diagnosis. However, if you want to look at the totality of the patient, I then present a question to you. Why would you choose chiropractic when you can choose something called functional medicine? These are physicians that I personally was, let's say, consulted by, who I feel have a higher level of expertise and understanding of the body than a chiropractor can have, simply because they went through medical training, residency training, and etc. And they could probably understand the nature of disease a little bit more profoundly.
But you're bringing in a third option, right? That's a third option. But if somebody's asking between chiro and PT,
Right.
that's what. So what would you say to that?
I would not make a judgment on which one is better, which one is worse.
No, it's not about better or worse. Advantages versus disadvantages. That's all I'm asking. Dr. Tucker, what would you say about that?
So I think for me, it depends on when and where. I mean, they're both conservative practitioners, right? It's just that it depends on it depends on the case. There's a few things. So first, even with that third party consideration, I've met plenty of medical doctors who didn't necessarily pursue the lifestyle that you would necessarily look to for someone who's living, well or functionally. I think in our field, there's a lot of people that gravitate to natural living, which means they kind of lead by example in their own lives. So if someone was heavy on pathology, but was 100 pounds overweight, they might not be the best guidance for functional, healthy lifestyle. So we have to take that into consideration. Are we trying to rule out pathology or find wellness? For sickness, 100%, you would go to that third party. Now, as for a distinction between the two, well, here's an example. Let's say somebody comes to our office with a partial rotator cuff tear. They don't respond to some modalities we're doing quickly. Well, I'm not going to allocate an hour to watching them rehab their rotator cuff. I would refer them to a physical therapist. If somebody comes to me with, let's say, a massive right head tilt, torticollis, radiculopathy, constant tension headaches, like that's our wheelhouse. There's most likely some obstruction to nerve or blood flow, right? So in that case, I would just say, hey, we have a certain goal. Let's abide by this. Let's see what your outcomes are. And typically we have pretty great success rates. So I think it's just knowing how to manage what case and then communicating that. There's going to be some overlap, of course, right? I mean, they're musculoskeletal conditions. But again, I'm not going to watch someone do rotator rehab for an hour.
Gotcha. It's interesting you mentioned that, because as I'm kind of like digging in my consciousness about everything that I thought about chiropractic, I come to realize that I always felt as if chiropractors have a tremendous advantage of not relying on the actual referral or prescription, meaning they could be completely independent practitioners. So every time I thought to myself, why do I always rely on that doctor's script to, even if it's an out-of-pocket patient, which is required by law? I told myself, if I would be a chiro, that would not be necessary, thereby definitely creating advantage in that sense.
Okay. But you definitely started answering the question about if someone says, if I have a certain musculoskeletal issue, where should I go to?
So I actually had a discussion with Dr. Nektalov a few days ago. If he had to compare two interventions to the human body, one of them is chiropractic manipulation. Let's just assume that it's professional and properly done, assuming the diagnosis is properly established, versus therapeutic exercise, which is, let's say, a classical physical therapy modality. Which one of them is considered a more dominant and more, I would say, refined force in putting the person back on their feet? My opinion is that it's therapeutic exercise. And the reason I say that, so if I were to compare this general intervention called therapeutic exercise with, let's say, chiropractic modality, in my view, therapeutic exercise supersedes chiropractic manipulation because it is the most well-researched and the most well-tried application to the human body. So in that sense, I feel like PT maybe is slightly ahead of the game.
So, Dr. Taka, we actually had this conversation before. I want to hear your opinion about it. So we had an argument that, let's just say take the most biggest complaint that people have, back pain, right? So we try
Can
to
we piggyback on one point there for just a moment?
go ahead.
And it's like asking, is diet or exercise better? I think that's part of the challenge with people assuming that exercise is the only way to get motion, right? There's passive and active ways, especially when someone's too symptomatic to perform active exercises. They might need palliative relief passively first. They can't do a sit-up yet because they're in too much pain. We get them out of pain and then we tell them to go exercise. Plus, the assumption is active care is the only way to get motion in the joint. So to get neurogenesis, right? To get nerve repairing, more neurons forming, you can do it both ways. You could have someone passively adjust your spine and develop neurogenesis for healing, or you could exercise it. So they shouldn't be mutually exclusive. Again, I think sometimes that's misunderstood. You can get nerve repair both ways. The question is, why is not enough referrals focused on the passive means? And then the active component, I would say, depends on the place. Are you just having a generic 15-minute bicycle station set up for a 97110? Or is it real rehab with real, compound movement exercises like anybody who's really fit would understand?
So, Dr. Tucker, do you also agree that massage is not technically a physical therapy?
I mean, if you ask an LMT, they might not agree with that. Doesn't mean there's no overlap, of course.
Okay. Your opinion, doctor?
No, I feel like massage therapy is not only one of the codes that is in the physical therapy code book, it's also something that we learned in physical therapy as an actual legitimate application or modality. So I feel like massage therapy is definitely one of the things that PTs could be or should be doing. There's not much that they do, but could be.
But the backbone of physical therapy, do you agree that physical exercise, therapeutic exercise, is the physical therapy? Just for us, like manipulating the spine. We can also manipulate and adjust the joints of extremities, but the backbone of what chiropractors are known for is the spine.
Right. But I feel like the backbone for physical therapists will be two things that are competing with each other. One of them is therapeutic exercise. The other one is joint mobilizations. And joint mobilizations, by the way, can range from grade 1 to grade 4. Grade 4, I would say, edging on the side of manipulation, but there is no manipulation involved.
So do you, Dr. Gabriel, do you agree with Dr. Tucker that in acute situation, I think it's passively creating the mobility is preferred before they start the therapeutic exercise? You could say it from your own experience. Do you agree or disagree?
Yes, passive application is ideal for acute pain patient, yeah.
What about in chronic, Dr. Tucker? What would you say about that? In chronic situation?
What about the chronic case?
If somebody has back problems chronically, should you first apply physical therapy or not?
Well, first, the joke of DC isn't doctor of chiropractic. They call us doctor of chronics because by the time we see people, realistically, they've usually exhausted many options. So even though we're portal of entries, kind of like a family doc, they can come to us without referral.
Yes.
The reality is the majority of people have already gone to an MD, a PT, often an ortho. So many of the patients we see, unless they're referring younger family, already have exhausted these options. So in terms of asking which way they should go, it depends on the case. If they've exhausted PT, then obviously, and they haven't tried chiropractic, that's a no-brainer. It depends on the diagnosis. If I have a guy who comes in here with a six-pack and he has low back pain and his family doctor told him to go to a PT to strengthen his core, that doesn't make sense. His core is better than the doctor's core, right, that he was referred by. It wasn't a deficiency in a six-pack in his case. Now, if there's muscle asymmetry, maybe, right? But again, it just depends on the diagnosis. There's a time where I'll see something and I'll say, hey, here's what you need instead. I think step one, of course, I would need to have a little more clear-cut vision of what you're asking in terms of a specific diagnosis.
Got it. So The next question I have for you guys both is we still have this issue where we're afraid or refuse to refer to each other. Why is that mentality still exist?
So I was sitting in a class for physical therapy school, and the teacher asked whether the healthcare in America is business or not. And I was the only guy who did not raise his arm, thinking that it can't be business because it's healthcare. But as I entered the private practice and general, as I tried to understand, started to understand the way the healthcare works, it became very obvious that it is business. And I guess there is a tendency for me specifically is to keep my patients within my office, especially because I have a pain management physician who comes to my place. So sometimes or frequently, I feel like between pain management and physical therapy, we're able to do a lot of things that can help patients. So we try not to refer them out unless they need an orthopedic surgery. In that case, they get referred to some surgeons we know. And nutritionists, sometimes they really need help understanding how to eat and what not to eat.
Your opinion, Dr. Tucker?
So in my particular case, I don't yank people from physical therapy. But in all candor, I'm also frustrated they don't refer. And I think the honest answer is they don't want to burn their referral bridges. Chiropractors have to have exceptional outcomes as portal of entry doctors to generate busy practices, meaning you got to get good results. If you're getting fed by a source, which family doctors typically refer to PT, I find I don't get referrals from PTs, but I'm sending them to PT. And I'll give you a classic example. I had a neighbor who was a geriatric medicine doctor, worked for a large hospital chain nearby. And I asked him, hey, where do you send your musculoskeletal cases? So he told me about his particular PT that's under the same umbrella, of course. You know, they're not looking at everything everything's compartmentalized, right? You go to their knee guy, their shoulder guy, 17 different visits. Chiro never comes into the equation because they're not under that hospital umbrella. And I said, well, how are the outcomes with that PT? He said, they suck. I go, so why do you send them there? Because I'm under that umbrella. So he wasn't really looking for clinical outcomes or necessarily retention. He just kind of has orders, so to speak. For me, if I think, again, someone needs to rehab a knee post-surgery, I'm sending them to PT. The bias seems to be unilateral in terms of referrals, at least in my particular clinic.
Awesome. Anything to add, Dr. Malkoff, to that?
I would love to know what is it that stops other chiros to refer to PT if you are somebody who actually does refer.
Me too. I do refer as well. In fact, I have two physical therapists. Truly, I think I agree with Dr. Tucker. I never get physical therapists to refer, except you, Dr. Malakoff, because we're friends, maybe. But I've never had a physical therapist refer to a PT. I don't know why they feel like it's a conflict, but it isn't. Not.
I got a funny story on that. So my wife's a physical therapist, and she was in school, and she was honest and said, hey, there was a little bit of trash talking, and they're like, how nobody should get adjusted. So my question to her, and she asked the teacher and the friends, and I never got a response, was, if it's such an unnecessary thing to adjust the spine, why do they do grade 4 and grade 5 mobilizations, which try to copycat a little bit of that adjustment? To this day, I haven't had a good answer for somebody who talks poorly about the adjustment or the necessity for it, but yet tries to do it, because I'm sure docs, you've probably heard of LMTs trying it, DOs trying it, family doctors trying it, PTs trying it. Everyone has something to say, but it seems like there's a lot of people trying to work on the spine in a manipulative fashion.
Good point. Anything you can add, Dr. Malkoff, about that?
No, I think it's a very spot on response to the question. Yeah, it really is.
In fact, I know one guy in our city, Queen City. He's a physical therapist. Not gonna mention the name. He calls himself osteopractor. I mean, he took classes on adjusting, manipulating, but why even call osteopractic? You're not a. There's no such thing.
Because that's when you lose your philosophy. That would be like a chiropractor telling a patient what medication to take when they have an upset, bellyache. That's not your scope, number one. Number
Right.
two, that means you're not convicted to your purpose.
Okay, very good. I have very last question to each of you. If you could change one thing about how chiros approach rehab, or how the PT, the physical therapist, could approach rehab. So for you, Dr. Malako, if you could change one thing how the chiropractors approach rehab, what would that be?
I will have to tweak your question a little bit
No
to
problem.
actually address something that has been on my mind.
No problem.
Feel like within every single specialty, there is probably, if I had to put a percentage, 70 to 80% mediocrity and 20% of excellence. So I feel like if there's one thing that I would change in PT, Chiro, or any other specialty, is bringing that number to become much, much lower so that everywhere that patients go, they can get excellent care rather than mediocre or substandard.
Okay.
That's
All
fair.
right. That's
Yeah.
fair. I agree with that. And Dr. Tucker, what would you? Is there anything you would change, or the way they approach rehab, the physical therapists? I'm sure you get patients that come in. They say, "I've been to physical therapists, and this is what they've done."
To be honest, is to stop worrying about insurance and worry about patient outcomes. So when I have people who are seeing a PT at the same time, they're being told, don't come, it might affect your insurance. And I understand there's a financial component, but it's, again, they're yanking them from care when the patient needs the care. You can game plan how to manage it post treatment, how to skip days. That's a different conversation. But don't go and just kind of using some vague insurance scare tactic just seems a little peculiar. I think the key point, though, is co-managing better. These are not mutually it's not exclusive. You can work together with passive and active components. They shouldn't be separate. But there has to be a desire to want to refer bilaterally. And of course, like any field, you have to have exceptional practitioners. So the challenge in our field is if someone goes to a chiropractor they did not get outcomes with, and let's just say they call it a bad chiropractor, they write off the entire profession. My doctor said never go again. My PT said never go again. But if they go to a bad MD or they go to a bad PT, what do you think they do? They find another one.
Sure.
And I think that's the idea. Find somebody who's exceptional to start with and focus on that 20, right?
No matter of insurance coverage or not.
Well, it depends. I mean, when you go eat a healthy dinner, is your number one focus,
How much it costs?
insurance?
Right.
Well, cost could be a factor, of course. But I think you have to prioritize. And again, most states, chiropractic is covered by most insurances.
Right.
Right. So, it was a different story 100 years ago. That's not the case today. Insurances may be challenging, but that's, again, you might have an $80 copay with PT or a $70 copay with Chiro. That's not different necessarily. The issue is they write the entire field off. And that doesn't make sense when you should find somebody who's better.
I would like you, gentlemen, either one of you or both, to respond to the following question that has been in my mind for a while now. Chiropractors frequently view themselves as point of entry healthcare practitioners, but I still do not understand how you can view yourselves as point of entry practitioners, assuming that you had not been exposed to the same level of education as medical doctors. And I'm not saying they're better or worse. I'm just saying that they studied biochemistry, physiology, histology, and other subjects to much deeper level. Why should somebody be coming to Kairos for, pain in the liver and the stomach or throat or whatever it is?
So I don't think most people go to chiropractors for a liver pain, right? That's not statistically relevant. I think the majority of intakes you see are going to be neck pain, back pain, headaches. So let's use headaches. Why would someone want to go to a chiropractor before their family doctor? Well, I would say it depends on their goal. If they want to get Topamax and live on drugs, then yeah, you don't go to the chiropractor. To assume that everyone has a brain tumor or something extreme the majority of these are tension headaches. The majority of those are either dietary, stress, or cervicogenic issues. So as long as the practitioner knows how to manage the condition at the point of entry, it makes perfect sense to me because they are looking for options outside of drugs or surgery. There's a growing population that's tired of being on pharmaceuticals endlessly, right? For 20 years with a growing list. So if your first point of contact is a chiropractor, you are less likely to end up with drugs or surgery. And it's not like patients are stupid. If they're not getting outcomes, they would go somewhere else. Obviously, if they were getting results and they're staying there, then it means it's working. So that first access point gave more of a conservative treatment protocol.
Okay, so based on what you're saying, it is probably more precise to call you guys point of entry spine practitioners, because you're saying that you would not deal with somebody with stomach ache or heart dysfunction or whatever it is. So you just deal with somebody with a spine or headache. Is that correct?
Yeah, and I'll pivot a little bit to kind of
Please.
humor some of these visceral issues. Before it was cool to be functional medicine, it was just called medicine. Before they slapped a wellness sign on hospitals where treatments didn't change, it was just a buzzword for SEO purposes, right? Everyone started putting wellness in their name. Chiropractors were talking about supplements. I remember 20 years ago in practice, I visited a family doctor who told some patient of mine, and I can't remember what supplement I put him on, that it was a joke, he didn't need it. Went to his office, didn't need chiropractic, didn't need the supplement. I visited the doctor, limping, overweight, plenty of medical issues, did not look like the epitome of health himself. Years later, started promoting supplements. So I think a lot of chiropractors who did postgraduate work, who've invested heavy time into lifestyle habits, are sometimes a better authority for natural living than somebody who's focused on pharmaceuticals. But again, it depends on the patient goal, right? So functional medicine wasn't cool 30 years ago, but there was DCs doing it back then, right? Ordering labs, providing other alternative options to manage elevated labs. There's other things you can do besides drugs.
Amazing.
You know, we actually had this conversation with Dr. David Tucker. I'm having a hard time finding this. The question that Dr. Malakov asked about the DC versus MD. Remember, Dr. David, about how we talked about the curriculum, the amount of hours. He mentioned that we don't get the same amount of education. You're actually wrong. I'm having a hard time, but I will post this on video. The actual curriculum, the amount of hours, the basic sciences that we take is the same, if not more. The only difference that they do more is pathology, and then they do residency that we don't. But when it comes to education of human body, I'm talking about visceral aspect, we get a lot of classes and education about that. So,
But more so, if you had to refer someone out, you would do it the same way a family doctor would, right? If you see something that's outside of your scope, you're sending them to a specialist, right? If you see an abnormal skin lesion, you're not adjusting their spine, you're sending them to a dermatologist, right?
Correct.
And I think that's the understanding, is that there's this feel like you're not monopolizing every condition, you're just screening people from a different lens.
and we're not claiming that we're treating every condition there is. We're not. If we can recognize it's out of our scope, that's it. You're out. You go to where it's appropriate. 100%. One last thing, before we're gonna conclude, I want to address one thing that's been bothering me a lot. A lot of we get bad rap. I don't know about physical therapists, but chiropractors get bad rap. Oh, they're nothing. Oh, it's just a quick click. Where are they getting this rap? Based on your opinion, my opinion, based on what I'm asking my patient, what was your experience with chiropractic? And the what they tell me is, when I was in a car accident, I was referred to this clinic. I call it a factory, where they see 100 patients in a day, and it's just a factory mill. and the experience they get from as far as chiropractic is click, click, or crack, crack, and you out. I'm sure the same thing with physical therapy. When I ask what have they done when you did physical therapy, stem, hot pack, massage, and the massage not by hand, by the machine. What's your experience with that?
I feel like my response to that question has to do with what I already previously stated, that 60, 70, 80% of the time they receive very poor care. So when they're exposed to this kind of chiropractic care where it's 1, 2, 3, they already develop a perception that it's not a serious type of practitioner. So unfortunately, we want to just change that ratio to become chiro and PT to make it a little bit more professional, more proper, and more up to par.
Dr. Tucker, any experience with that?
Yeah, agreed. I think the issue is with those personal injury facilities, there's a lot of automation, and it could be for DC or PT, and that's fine, but it's more code focused, not treatment focused, possibly. For me, relative to other chiros, if they've seen somebody in the past and they're still struggling, my first question is, what was your diagnosis? If the patient can't tell me, they might not have had the best experience in the past.
Got it. All right. I appreciate for your time. It was very well spoken by both of you. Hopefully our audience can understand where can they deviate to. But as the last thing, do you guys also agree that the patient can benefit from both aspects of treatment?
Yeah, I believe it's about taking responsibility. Ultimately, it's honestly about taking responsibility for your health. It's really not about PT or chiro. It's about asking yourself a question: how do I get myself to the point of excellence and longevity? And how do I maintain not only my spine, but my entire body and my brain function in the most optimal condition possible? I think that's the ultimate question we want to ask ourselves.
I agree. All right. Thanks a lot, guys.
Thank you.
Take care.